Good morning all, welcome to Snippet 6 of how light affects health. Today we're going to look at blood pressure and how blood pressure is positively influenced by a range of different light wavelengths. From UV light to blue light to red light to infrared light, there are a lot of different wavelengths of light that seem to have a positive effect in one way or another. And given the year we've all had, where people's stress levels have probably gone up, people's anxiety has definitely gone up, people's weight has definitely gone up if you look at the research studies coming out now, all those things lead to an increase in blood pressure, which is associated with increases in various other health risk factors. And therefore, is there a way to be able to help lower your blood pressure just by using light? And the positive thing is the research suggests yes. And I'm not talking 2 or 3 millimeters of mercury, I'm talking 8 to 10 to 12 millimeters of mercury. So a fairly significant drop in some of these research papers. And as I said, it seems to be you seem to be able to get a reduction in blood pressure through UV light, through blue light, through red light, through infrared light, and of course all of these are available through the sun, which I'm getting now. So as well as all those other positive benefits of being out in the sun, I am also helping to lower my blood pressure. But we also know that being outside in and around trees, on the grass, in nature, helps lower anxiety levels, which lowers blood pressure. So it's never a case of a closed system. It's always an open system, and I mean that by it's not just one and one. It's like one and one, and then there'll be one over there and one back there and one back there, and they're all affected either negatively or positively. And light is one of those things that has a multitude of positive effects. So if we look at, as I say, so blood pressure can be reduced with UV light, it can be reduced with blue light, it can be reduced with red light, it can be reduced with infrared light, and that's what the studies show. And we can either do that in individual light wavelengths. So for example, I have a blue and red bulb, I have a blue and red light panel, because what they did with the blue light in this research study is they shone blue light at 450 or 460 nanometers over someone's whole body, and they reduced their blood pressure by around 10 millimeters of mercury, I think it was. So it's 30 minutes of blue light, and they reduced their blood pressure by 10 millimeters of mercury, which is pretty impressive if you think about it. So I have one of those. I also have red and infrared, and so what they do with the red and infrared, and what's very positive about the red and infrared, is that the red and infrared both actually help reduce blood pressure, but they also help improve circulation, and they've also been shown to help with your vascular rigidity, i.e. they make your blood vessels a little bit more flexible, a little bit more pliable, and that's good. We want our blood vessels to be able to expand and contract in order to deal with what's going on. Stiff blood vessels are not a good thing, so we want flexible blood vessels, and red and infrared light have been shown to do that, but they also improve that circulation both locally and systemically. And there's some good research out where people have used intravenous light, which is a very interesting thing. So it's an intravenous light. And also they've used intranasal light. So I have intranasal lights, I have intra-ear lights as well. And both of those have been shown to decrease blood pressure. And that just goes to show that how I've talked about this before, how we can shine a red and infrared light on certain areas, but we can also see a more systemic effect of that light stimulation in a specific area. We can see the systemic effects of it, we can see the benefits of it in other areas, and intranasal light therapy is one of those areas where we shove 2 light probes up your nose and we see a reduction in blood pressure, and we see the ability of the body to transfer those kind of anti-inflammatory messages around the body, to a lesser extent obviously than if you were to shine the whole light on your body. You would get much more of a message being sent through. But if you are interested in lowering your blood pressure, someone's told you about you have slightly high blood pressure, then I would seriously suggest that you look at the available options to you, because light, as I say, you can get a good dose of light from the sun, but you might also want to look at specific areas like red and infrared, because you can get that from the sun, but you need a lot more time outdoors. If you are someone that wants to lower their blood pressure, maybe to help with certain aspects of pain or reduce some inflammation, then I would always look at getting a device for you to have indoors that you can use at your leisure. But there we go. So there are many wavelengths of light, UV, blue, red, infrared, that all help, that all have been shown to help with lowering your blood pressure. And so if you are someone that has an issue with that, seriously look at getting more light in your life.